Okay. Anyway, Dr. Rajat Chhattopadhyay is, he has joined. He is, okay, I made him as a co-host. Okay, Dr. Rajat Chhattopadhyay has 27 years of professional experience. He got PhD in homeopathy, MD in homeopathy, and MBA in healthcare. He worked as a principal in Calcutta Homeopathic Medical College and author of 3 books. And one book is about cardiology and many research publications, many papers presented internationally and nationally, many research work he took part, and now serving as a professor and principal and administrator, office in charge of Bengal University for 5 years, and many others have to say about Dr. Rajat Chhattopadhyay. And we already, and HOD, he worked as a HOD for 12 years in Government Homeopathic Institute, and experienced head examiner and moderator, and in UG, PG, PhD exams, chairman of drug proving committee in CCRH, and member of DST Ayush R&D project evaluation committee, member of WBMCC of Government of West Bengal. And today's our topic is summer complaints and homeopathy. Dr. Rajat, please welcome to our session. We are so glad to get you as a speaker in today's session. Doctor,
thank
please.
you. Namaskar.
Namaskar.
Am I audible? Am I audible?
Yes, sir. Yes, sir.
Thank you. I want to share my screen also.
You can share, sir.
You can. Sir, what happened, sir?
Shared my screen, but shared screen option is not available here. That's why.
Sir, you can see the toolbar down, and after the participants, you can see the share screen. Please click on the share screen.
Host tools.
Sir, you can see the mic picture, then the video, then security participants, and share screen. Please press the share screen, the green one.
No, share screen is not coming here. That's why. It is who can start a collaboration.
Sir, do one thing. You log out from this and again rejoin, please.
Okay. Okay.
Sahani sir, in that gap you can talk something useful for the audience. Sir, what happened? You are mute, sir.
Yeah, I got it. Now the summer is here, and with this summer, I think you are in Kerala. You may not be experiencing the heat that we are facing nowadays here in Patna.
No, sir. Now the climate has changed in Kerala also. It's very hot.
And,
but now I came to UAE, so here it is nice. I'm in Dubai.
So you are lucky there. But for the summer, I recently suffered from the summer stroke, some heat stroke. The last week I was hospitalized for getting the summer stroke, heat stroke. I had a vomiting, and then after a lot. But along with the homeopathic medicines, I got well within three days. I came back to my
normal life.
I came back to my residence, and I am now perfectly okay. I am taking care of it. So lot of the fluid is required. This is important factors that I see. And some of the medicines that the only one medicines that helped me and that was prescribed by my son, that was the belladonna. And it worked like, I think belladonna and along with the ORS and then the water that was being, saline was there. So I got well immediately. Everything is okay now. So, but summary complaints needs to be understood in relation with the individual sensitivity with the heat. Many people don't experience the heat, and many people with the slightest heat they get the problem. So this sensitivity is very important, and this sensitivity is dependent on various factors. And I think this various factor will be need to be taken care for that. I think Dr. Rajat has now shared his screen, and he will be starting.
Shared the screen, but he has not joined. I think he joined from.
Someone else has shared his screen, and now he will be joining. He will be representing now. So we don't have to serious, but we have to look for the symptoms, what is presenting there, because every stroke is not the same. It is different. Sensitivity, because sensitivity for the human beings are different for the individual. So individualistic approach is very important. And also, the climatic influence and the local environmental influence, that is also very important. That needs to be taken care. And holistic approach of the totality that can be framed on basis of taking care of the individuality, the environmental relationship of the human individual persons. This is the approach. I think there are a lot of medicines mentioned in our repertory and the Mathematica about the heat stroke, but things works only when all the symptoms are coincide together with the totality. And definitely it has homeopathy works wonder during the heat strokes. Dr. Rajat, are you ready? Dr. Rajat? Yeah. He has joined. He is open. He can talk now. Dr. Rajat, you can talk.
He has joined. Yeah, I made him as a co-host.
Yeah.
Okay, Dr. Rajat, you can start now.
The slide is visible?
Visible, sir. Visible, sir. You start yourself. Sir.
I can't see the slides.
The slide is visible, sir. We can see you see your slides.
1 minute, sir. Just 1 minute. Something. What is happening?
Sir, you make side by side gallery. Then you can see at the same time, you can see both.
Dr. Hubert, are you there?
Yeah, but I heard his voice.
You cannot see, sir?
I can't see the slides.
Oh,
you just make view side by side gallery. Then you can see at the same time, you can see the all yourself and the screen. Summer complaints homeopathy.
It's visible here. Otherwise,
now it is gone.
Okay, please share once again and start slideshow. That also will help, no?
Yeah, slideshow is better.
Yeah.
Okay. Now it is appearing. Now it is okay, sir. You can unmute.
Yeah, now it is in the slideshow.
You unmute, sir. Yeah. Now it is okay.
Oh, summer complaints and homeopathy.
Okay.
It is right now we are going through the scorching heat, and so it is a very relevant topic related to right now. It is we are going through the summer complaints and heat stroke right now. Just half an hour back here in my residential area, just one died just due to heat cramp, and just 18 years old. So we are going through these summer complaints. And so what, as a homeopath, what we can do, what should be our approach, and what are the summer complaints, and what happened from physiological point of view, pathological point of view, clinical medicine point of view, and obviously as a homeopath, what our medicine can do. That's just refreshing our memories. The frequency of heat waves has increased in recent years, consistent with anthropogenic climate change, and evidence suggests that temperature extremes are a leading cause of weather-related mortality worldwide. That's I was talking about this. The mortality this month, only within the week, here more than 18 as the victim of this scorching heat. The burden of disease associated with extreme heat is particularly pronounced in low and middle income countries such as India, where extreme environmental exposure intersect with unplanned urbanization, poor quality housing, declining urban green cover, and other vulnerabilities in the world's most popular country. So heat waves significantly impact ecosystems and human health, especially that of vulnerable populations, and are associated with increased morbidity and mortality. Besides being directly related to climate-sensitive health outcome, heat waves have indirectly increased the burden of our healthcare system. Extremely heat events can be dangerous, even fatal. These events result in increased hospital admissions for heat-related illness, as well as cardiovascular and respiratory disorders. So what is the pathophysiology of heat illness? I think the slides are it is all can see the slides. The slides are available now.
Yes, sir, it's visible.
Okay, it's visible. Okay, thank you. Okay. So in the pathophysiology of heat illness, the heat illness referred to pathophysiological changes resulting from exposure to heat, whether at rest or during exertion. It may be during work, it may be during sports, it may be during you taking the classes. Right now, the summer holidays, still it is abating. So during taking classes or the students, it may anytime can range from heat exertion to heat stroke. And we have the human thermoregulation, we all know. Throughout evolution, humans have adapted to temperature fluctuations. Thermoadaptation and regulation are crucial functions of the autonomic nervous system. And responses to heat involve redistributing blood flow and increasing sweat secretion. So these are our responses. That is the blood flow redirected to the skin. For this is from our part, that is vis medicatrix naturae as per organ and homeopathic philosophy. So our body try to make up this, to cope up with this scorching heat. So vasodilatation, increased sweat secretion, elevated cardiac output, stress response. The renal stress, what is the renal stress? It is due to hypovolemia and dehydration. We all know about this. And the prolonged heat stress can lead to organ dysfunction even. The pathophysiological reactions, pro-inflammatory cytokines, this is very important. Pro-inflammatory cytokines play a significant role. Similar responses seen in fever and extreme heat exposure can lead to systemic inflammatory response syndrome. These SIRS, the systematic inflammatory response syndrome and multi-organ dysfunction is very important. That's why whenever one patient having diabetes mellitus, one patient having hyperuricemia, one patient having hypertriglyceride, cholesterolemia, dyslipidemia, all these type of patient may have, or the autoimmunity mediated arthritis, suddenly you may say that the winter is the one crucial point for the pain increasing for arthritis. But summer, excessive heat also, it can provoke the systematic inflammatory response syndrome. So whenever chronic inflammation is there, so excessive heat can exaggerate all the chronic conditions also, this type of heat. And vulnerable groups, what are the vulnerable groups? Obviously elderly, young children, chronically ill individuals, kidney patients, CNS disease patients, alcoholics, those on certain medications, especially chronic diuretic users. And these need further research. These are a small, that heat wave is coming, that heat gain, how the body temperature is regulated. You can see the three colors, that is the pink colors are reddish, one is bluish, and it is greenish. The greenish is slight fade. So you can see how the heart rate, the cardiac output can increase, how the myocardial contractility, that stroke volume become increased, and how it is the straight line, it is the direct effect, the increase or positive effect, and the dotted line at the decrease or negative feedback. You can see the dotted line with the negative feedback. So with the negative feedback, there is the cutaneous vasodilatation, sweat rate, and again, from dehydration, the heat loss. So this is going on within our body. It is our attempt from our body. You can see this, a schematic summary of the integrated physiological responses. Again, the word vis medicatrix naturae of our organ, that is our body, our vital force. That from up to the even they try to prevent all type of injury to the body of their own, but they are unintelligent. We know that vital force is unintelligent. So with the physiological level, they can
What happened, doctor?
cause this type of things. This type of mechanism is good for health, but this type of mechanism also in the long run, it can cause, ultimately it may cause renal failure, it may cause even acute renal failure, but it is a part of the body to prevent you from the sudden emergency. So these are the mechanisms we can, it is right now, we are all the physicians, so we will go give more emphasis to the approach direct. The review based on a president's lecture at the annual meeting of the American College of Sports Medicine that examines the impact of climate change on the aging cardiovascular system. The main thing of this slide is that is the geriatrics patient or the aged patient, the patient above 60, 65, 70, they are very much vulnerable to this heat stress. You can see in the next slides, this is, you can see the cardiovascular reduced cardiac output, increased prototropic dependence, increased myocardial strain, blunted peripheral vascular responses, reduced central vascular responses, reduced cerebrovascular regulation, and increased coagulation. So increased coagulation. Right now, we are in the also going through a very dilemma stage that the bad effect of vaccination is there or not, that whether the Covishield is due to any thrombolytic effect is there or not. Right now, the paper has come that only out of 110,000 may be affected, but whether the coagulation part is very important. So direct this type of heat stress, increased risk, it may cause heat stroke, it may cause AMI, acute myocardial infarction, it may cause thrombosis, it may cause ischemic stroke, it may cause electrolytic imbalance and renal function dysfunctions, acute kidney failure. These are all well known to us. These are all well known to us. But all the patients of ischemic heart disease or hello? 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 Hello. So
Yes. What happens, sir?
Patients of ischemic heart disease or all the patients of diabetes mellitus, all the patients of chronic CKD, chronic kidney disease, or even the CLD, chronic liver disease, they should take most care or utmost importance during this, because this weather, the weather may increase everything. This is a Venn diagram summarizing the age-related impairments in the integrated physiological responses and to heat stress thought to contribute to the increased risk of acute adverse health events in order relative to young adults during heat waves. Hello?
Sir,
So
please
what are the
continue.
common summon complaints? What are the common summon complaints? Please, I can go through very quick look to few disorders. Then again, I will come back to this. Skin redness and inflammations due to exposure to sun's UV rays, pains, tenderness, sometimes blistering of the affected area, increased risk of long-term skin damage and skin cancer. You know sunburns, but we often don't use, I will not use the drug Cantharis. Cantharis is very good drug for sunburns. It is not only natrum carb, it is not only natrum mute, it is not only related to other skin, but I can't say that Cantharis is the only drug. But you can see that frequently we can get the patient of this type of inflammations with the sunburns, and the carbon within the sunburns, the Cantharis is one of the most important drugs we should know. Then again, the next one, heat exhaustion. The heat exhaustion, the dehydration, electrolyte imbalance from prolonged exposure to high temperatures, and the drug, gelsemium. The gelsemium is a drug, we know it is called the antiviral for the viral disorders, viral fever. It is very important, but gelsemium is also important in heat exhaustion. Whenever there is exhaustion, whenever after heat, after stroke, exhaustion, carbovage may be in the later stage, but first of all, gelsemium is one of the drugs that is the dullness, dizziness, very important in the weakness. The gelsemium is a drug. Dehydration, we know about dehydration. There are so many drugs from sicalicot to camphor to arsenic album, so many drugs for dehydration, but here only intentionally just only one drug, the veratrum album, with profuse sweating and icy coldness of the body, with intense thirst for large quantities of cold water, and like arsenic, vomiting and diarrhea. But veratrum album is not like arsenic album in the mental. Restlessness is there, restlessness in the physical, but mentally restlessness like arsenic, it lacks in veratrum album. Then come the number. If I say the number one is here, it is like Cantharis, that is sunburn. The number two will be prickly heat. Very common. And in India, in West Bengal, in Assam, in the moist areas, like in the low areas, Mercy districts, or during before rainy season, this prickly heat rash, red itchy rash that develops on the skin caused by blocked sweat ducts, and the drugs like Rustux. We know Rustux due to its redness. We know belladonna, one of the most important drugs. We also use Syzygium jambolinum, which is very often used for as a mother tincture for the diabetic patient. But Syzygium jambolinum in the potency, we got very good result. I will come in the later slides that Syzygium jambolinum also in the potency, in the 6 or 30, I use 30. Syzygium jambolinum in 30 or 6 potency, it is very efficacious in this type of prickly heat. Also, we can use calendula in 30 potency, not in 200 like that. In 30 potency or lower potency, calendula also internally, not for external application. Calendula and Syzygium jambolinum both usually used as mother tinctures or external applications for the calendula, but calendula internally and Syzygium jambolinum in potency 6 or 30 internally is very good efficacious for prickly heat. The allergies, we know allergies, the nasal allergies, the allergic rhinitis, like increased pollen during summer. These allergies may often happen because the exposure to air condition, exposure to cold areas, then again exposure to hot areas. So the outdoor workers or outdoor daily passengers, they are even prone to these type of allergies. And as because rain is not there, so many dust, so much dust. So We know drug like allium cepa, we know drug like arsenic album, we know drug like ars iode, we know drug like even pothos fetida. Pothos fetida, when passing flatus is very much ameliorated, but pothos is something different. It will be more during rainy season, more during that. But also pothos may be effective if the patient is giving you the symptoms, even the spongy also. But for allergies, I use this allium cepa and also the arsenic album. And for continuous sneezing, I also use one drug that is nicolam. Nicolam in 6 potency or 30 potency. I have seen the results on all these drugs. Like insect bites and stings, even it may appears like insect bites and stings, but ultimately it may appear as sunburn or anything related to heat rash. But there are very many skin conditions which will appear like insect bites and stings. In reality, it may be insect bites and stings, but in many cases, you may find ultimately there was no insect bites and stings, but the appearance of the skin, it seems to be of insect bites and stings. And we know that Apis mellifica type drug where thirstlethness is there, swelling is there, the puffy swelling may not be there, but the inflammatory edema, inflammatory swelling of Apis mellifica, particularly for this may be the pathological sibilimum in very many cases, and it can give you very quick relief from this inflammatory edema. Food poisoning, another one part, because during these hot weather, scorching heat weather, we usually very often take the cold water without considering the quality of the water, quality of the drinking water, whether it is potable water, whether it is safe to drink. But very often the child, the adolescent, the young 18, 19 years college going or school going boys, they take the waters or ice which are not very hygienic. So food poisoning are very important also. I have the slides in the latter part that the food poisoning part or the summer diarrhea is very common. It may be due to poor hygiene. It may be due to very taking impure water. It may be due to taking cut fruits in the open environment with contaminated fruits, but also direct the very scorching heat or excessive heat can cause your physiologically, it may cause diarrhea. I will show you in the slides that it is a direct cause without you have done nothing. You have not done anything wrong, but you are the sufferer of diarrhea. It may be related to direct heat. Arsenicum album is the drug of choice in food poisoning, you know, and it is not that in all food poisoning you will give arsenicum album, but the most of the patient will come you, the presenting symptoms will be resembling like arsenicum album. So like nausea, vomiting, diarrhea, mental irritation, taking water, very small time. And symptoms are often accompanied by restlessness and anxiety. This is very important. The patient is lying still. There is no restlessness, no anxiety. Whether it is food poisoning, whether the patient is having diarrhea and vomiting, but we should not think for arsenic if the mental restlessness and anxiety is not there. So there may be any other drug may come. This is very important. Exacerbation of chronic conditions. The patient has been suffering from COPD, from bronchial asthma, from chronic eczema. And these type of, we know that asthma or eczema, these are directly related to allergic situations and inflammatory conditions. So these may exacerbate. And the constitutional treatment is the best. Here only one drug is written, sulfur, but it doesn't mean that sulfur is the only drug. It may be thuja, it may be even carcinosin. And one drug, I must say, it is very wonderful drug, that is lysine. You can use the drug lysine, which is very often used for allergic rhinitis and for continuous sneezing without any cause. A patient not having any dust allergies, but the coughing, the sneezing, continuous sneezing like Nicholas, that sneezing, it is, and having the history of dog bite or history of taking the injections of dog bites, or patient something symptoms of constitutional like lysine. So lysine is also one of the, it may be used as intercurrent also, it may be used as constitutional also, but I would like to refer books of Dr. S.P. Dev to lysine, and to know more lysine. If you apply it more or more, then you can say the benefit. Lysine is maybe indicated in very many conditions. The conditions are not written under lysine. But lysine, if you think as intercurrent or you think the patient is of like lysine in these type of allergic conditions and chronic allergic condition, lysine also is a good choice. So you can see the sulfur. It is the acute condition, but we are considering sulfur because it is the acute exacerbation of the chronic conditions. Like that, in the as intercurrent, the catsiprocin may come, lysine may come. We often use Bacillarium tuberculinum, but Bacillarium and tuberculinum should be used very cautiously. If you are in dilemma that whether you will use Bacillarium or tuberculinum, better to give Aviare. Aviare is the same drug. It prepared from tuberculin chest of birds. So it is very minimal type of tubercular infection, and so the very minimal risk. And Aviare 30 is very good drug. It is not very well proved, but in clinically it is efficacious in influenza type disorders. It is often abused during influenza also. But patient having Bacillarium or tuberculinum like diathesis or like constitution and general condition is not permitting or allowing you to prescribe your you are in fix that what to prescribe, but the patient is giving you Bacillarium tuberculinum, you may think of Aviare. Then you can go when the general condition will be stable. You can think of tuberculinum Bacillarium. Swimmer's ear, the otitis externa, another one, infection or inflammation of the ear canal, often caused by water trapped in the ear, because during this summer the swimming clubs are totally filled up. And also during summer vacations, so swimmers here, this otitis externa also one of the very important part of this summer weather. And Pulsatilla, Silesia, Calisol, these are the drugs, even many more drugs we can think of. But Pulsatilla, very often, even in the very acute form, we know aconite, but aconite is directly related to dry, not cold wind. In summer, we should not think about aconite, but if patient is of aconite, even in the summer, if that type of suddenness or that even within the summer, if the thunderstorm come one day and the pain is there, we may think of aconite, but usually it not happen. But for the Pulsatilla, maybe the drug of choice in very many swimmers here for otitis externa, the feeling of block, that is not only feeling, there is infection. Ultimately, due to infection, you can see the yellow or green discharges. Usually, from the very beginning, yellow or green discharge is not available. Yellow and green discharge come later or afterwards. So, Pulsatilla is a drug of choice for its discharge, for its pathology. Also, the patient, if constitutionally is a Pulsatilla like shy or Pulsatilla characteristics with a thirstlessness, often we can think of Pulsatilla. But if patient having no characteristic and patient giving you very less symptom, but the pathological symptoms of ear blockage is there and greenish discharge is coming, you are not sure about the characteristics of Pulsatilla. If you give Pulsatilla, it will work, because in the pathology, in the sphere of action of Pulsatilla, this is there. So ultimately, as a partial remedy, it may act. The number one, that is sunstroke. This is a very alarming. All the death occur during this time. This is sunstroke or heat stroke, severe form of heat-related illness characterized by body temperature of 140 degrees. You can see our body temperature 40 degrees centigrade or higher. Right now, the heat wave is going on 44 to 46, 47. Just yesterday, one of our patient died. COPD patient, going well, only after taking our homeopathic medicine, some skin rashes are there and so many itching. He was complaining and complaining, but suddenly cardiac arrest occurred at right 12 noon time, like that, in the very when the heat is in the 44, more than 44 degree, and sudden cardiac arrest and patient died. So this severe form of heat related, our usual body temperature remains 36 to 40, and when it goes to 46, 47, 48, the very many patients, the aged patient and the child, they cannot succumb even. Or even if they are the patient of chronic any condition, so they are in very risk. So symptoms include confusion, rapid heartbeat, headache, nausea, unconsciousness, and it's a medical emergency, require immediate treatment. Even the death occur instantly. It may occur. So we may remain very cautious. Belladonna is one of the good choice. Clonoin is another choice. We have given natrum carb is the choice. There are very many drugs who will come in the later part. Here, belladonna is only pinpointed. Eye irritation is also very common during this summer weather due to so much dry air and dust. So red eye like belladonna, euphrasia, these are the choice of drug. Excessive sweating, hyperhidrosis. We know pulsatilla like one-sided sweat, and silicea, the profuse sweating. Chronicity of the silicea and the profuse sweating is there, but also from pathological point of view, silicea may be used in very many cases in the acute form, not due to constitutional sweating habit of the silicea. It may affect in conditions because all the tubercular diathesis patient, all the patient having pseudosora or diathesis of tubercular diathesis, they will sweat. It is very common. And silicea is one of the good anti-tubercular drug. It is not that silicea will only work. Pulsatilla also sweat, perspire. Silicea also perspire. Calcarea carb also perspire. All these tubercular drugs, perspiration are very common. So silicea also may be used during acute phase also. This is a new one. That is seasonal affective disorders. It is also called SAD. You know, SAD. It is not sad that sorrow. It is a seasonal affective disorder. So while commonly associated with winter, but some individuals may experience symptoms of depression or low mood during the summer months. Usually during winter season, the mood depression is a low mood, very common. But during summer, it is also right now it is increasing, and factors such as heat, humidity, disrupted sleep patterns, social isolation may contribute to summer onset SAD. Because during this scorching heat, it is not common to go to outdoors, to play caroms of the aged, to play badmintons, or to play something, even to play cricket or football like that with the outdoor games. It is not. So social even the isolation from the daily activities, it may cause depression of very many, because the aged patients are very sensitive to very many things. So during these summer weather, this seasonal affective disorders also we should take care of. An Oramet-like drug, which is the syphilis is in the waist. So the mood change, the feeling sadness, it may be the characteristic symptom of Oramet, but also just inversely we can say this type of personality, Oramet type of personality, during summer weather may develop these seasonal affective disorders, for which if the patient is of Oramet, we can think of Oramet. It is not that all patient will give Oramet blindly, because it is very deep-acting drug. And without the indications or the constitutional symptoms, Oramet should not be prescribed. Sleep disturbances are very common during heat, all not having ACs or not having coolers, and our socioeconomical status is not allowing us even not to any even fans. So sleep disturbances during this weather is very common, and mental anxiety. Coffea is the drug of insomnia, but coffea is here. The indications of coffea is irritability, the restlessness, the frequently, the mental irritability of coffea, also the physical irritability of chamomilla like that. But coffea may be affected, but coffea here only can cause partial cure. It is not constitutional. If the patient is of coffea type, okay. But otherwise, coffea will not be acting as constitutional remedy. Overexertion and heat-related muscle cramps, it is very common. The muscle cramp is very common in winter. It is very common in hypothyroid patient. All the hypothyroid patient are having TSH level little high, not very high, little high, and not taking medicine. And they're within the range of the physiological. But during summer heat, all these type of patient must have the muscle cramps. And whether they're acting or they're working more or not, even they're in resting phase, the heat cramps may occur. For heat cramps, natrum mur, causticum, any good antisodic drug in constitutional way, it can cause a miracle. The heat cramps, even without any medicine, only by maintaining the fluid level, we can think of a cure in this type of muscle cramps, which is very common related to heat. Heat-related edema is also common. You may see many of your patients of CKD or CLD, or many patients, they will complain you that doctors are, I having edema, I have no edema, but it is normal. But during at night phase, 9 p.m., 10 p.m., I can see my pedal edema is there, which is becoming normal whenever I am in the early morning after sleep. It is physiological, but the edema pattern, it is due to excessive summer Edema may occur in the obese patient. Edema may occur to the workers or with the occupations like chef is standing long, more than 12 hours standing, or police workers in the police, they have to stand, or the traffic police, traffic surgeon. So all these during summer, heat-related edema are very common. Sun sensitivity reaction. For sun sensitivity reaction, natrum group is drug of choice. Not only natrum card is directly related to cyanide, but any natrum group, even natrum sulf also. Natrum mur, natrum carb, natrum arts, natrum carb, all these drugs are sun sensitivity reactions. It may not only in the skins, it may be in other parts. So if the patient is of natrum group, we can differentiate it with the sun sensitivity reactions. And the last one for this part, that is travelers diarrhea. Travelers traveling to regions with poor sanitation and hygiene standards can increase the risk of travelers diarrhea, typically caused by ingesting contaminated food or water. Symptoms include frequent watery stools, abdominal cramps, nausea, and vomiting. And we know podophyllum about the summer diarrhea, but podophyllum pellet, the drug, podophyllum, which is very common in the morning. There is no stool usually in the evening. It's all stools more than 4 or 5 or 6 times in the morning. But podophyllum is the drug of choice for travelers diarrhea, especially in the summer weather. It may not be podophyllum effective in the winter season. So health impact of heat and heat-related intervals, normal human body, we are just recapitulating the thing. Normal human body temperature ranges between 36 to 37. So 97 to 98. And we can see right now we are going through the heat waves of 42 to 46. If 44 or 43 is becoming the normal, and our range is 36.4 to 37.2. So all should remain cautious. Very important. So exposure to high outdoor and indoor temperatures can induce heat stress, directly or indirectly linked to heat-related illness. Heat-related illness include from mild to severe heat rash, prickly heat, heat edema, heat cramps, heat tetany, heat syncope, that is fainting, heat exhaustion, heat stroke. Heat stress may also exacerbate chronic disease. Already I told this, that CVS and chronic kidney disease. These are all sunburn, heat-related disease, waterborne disease, seasonal allergies, insect bite. All I have mentioned, diarrhea, vomiting, sore eyes, a cough and cold, sunburn. So these are the heat strokes already. And heat strokes, it is, you can see, headache, dizziness, nausea, the symptoms, headache, dizziness, nausea, it appears like our Gelsemium type. So heat stroke or hypothermia is a common summer disease. What to do? What to move to person to a cooler place? It is not that only air conditioned, but comparatively cooler place, even in the road, under tree, big tree. So under the shadow, it is the cooler place. Help lower the person's temperature with cool clothes or a cool bath. And please don't give direct drink. This is very important one. During heat stroke, first of all, you make the temperature cool, but don't give anything to drink during the stroke. This is very alarming. We should know this. You should know this. And heat exhaustion and heat cramps. You know, heat exhaustion, heat cramps is also the move to a cool place, lose your clothes. And heat exhaustion, very simple, little water at a time. If you drink plenty of water at a time, 2 glasses of water, acute renal failure may cause. Acute renal failure may cause. It is very important. So during heat cramp also, you have to take drink. But here you can take more drink. And the heat cramps last longer than 1 hour. Then you have to take medical help, or otherwise just salt and low sodium diet, it may cure without taking any medicine. So we have the medicine like Glonoin, effects of sunstroke, you know, the headache, the sun headache, shocks in head. We have already told about the Gelsemium dull, the natrum mur, that I have not only natrum carb, natrum mur is also chronic effects of exposure to heat. Natrum mur is very much efficacious in kidney areas. Kidney areas, not only the skin, the chronic renal areas, renal disease. The natrum mur is the drug of choice. Amyl nitrosum for syncope, for cardiovascular type, violent beating of the heart and carotids. The sensation as if blood would start through skin with heat and redness, severe form. So amyl nitrosum, even by inhalation, the 6 or lower potency, it is very, very effective drug. during heat stroke. Veratrum carb also chronic effect of sunstroke. Belladonna already told Veratrum viridi, the effect of Veratrum album, Veratrum viridi effect of sunstroke. Even Arsenicum album, food poison, Bryony album. So Bryony album, we know that the days are hot, nights are cold, but during summer weather, days are hot, nights are not cold, nights are also hot. But Bryonia also may come here as a choice of drug. In very many conditions, whenever the symptoms of bryonia, characteristics of that unable to move, so much thirst and pain in all over the body, very thirst of large bodies of water, on the basis of the characteristic symptoms, whether it is heat stroke, whether it is heat cramp, whether the summer any complaint, but the characteristics of bryonia, if is there, we can use bryonia, because you don't forget that bryonia also is a very good, not only antiseptic, it's also very good anti-tubercular drug. Prickly heat and sunburn, I already mentioned, and you should not forget the use calendula in potency, Syzygium jambulinum in potency, and the constitutional treatment is good, it is good, but for acute relief, you can go through it. The Apis mellifica, Syzygium jambulinum, prickly heat in upper part of the body, small red pimples is violently sulfur. Sarsaparilla, summer cutaneous eruption with itching and rashes. This is the sarsaparilla, another drug, the new drug. Aconitum napellus, whether it is thunderstorm or not, whether it is dry, cold wind or not, but Aconitum napellus during summer weather, goose flesh or pruritus relieved by stimulus, rash-like measles, from the very active stage of inflammation before localization takes place. It is the characteristic constitution of Aconitum napellus we can give on the basis of characteristics, sunburn of Cantharis, and the Hippert-Sulf with the sensitivity. The sensitivity and not in acute state is in the subacute state or chronic state. Hippert-Sulf we may think of, but not in acute state. Diarrhea and vomiting are very common cause for taking dirty water, for the sanitation, poor hygiene, crowding, dirty hand, bacteria, viruses, all the bad foods. And the last one that I have not mentioned till that it is very common that during the summer weather, all the pets, they also want to stay with you within the cool places. So the bacteria and viruses, the zoonosis, that is the bacteria and viruses from the pets, from the dogs, from the cats, from all the pets to you, and from you to animals, these are very common also. So from there, diarrhea and vomiting also may happen. So after treatment, you should take precaution, or you may advise that, okay, you may keep your pets with you, but not in the very vicinity, and not that pets will touch your food, or the hygiene should be maintained. You have to take care of the hygiene of yourself, also of your pets. Homeopathic remedies like bryonia. China is one of the most important drugs during collapsing state. Whenever we are in collapsing stage, like camphor, China is another one. And China is very wonderfully this medicine. It is for no interaction of the for real our bodies. What I say that whenever we have exhausted everything, the carbohydrates may cause that the patient already died, but carbohydrates may win the game. The China, it is not like that. But whenever you are going through very low stage, even in the mood, even in the low mood, with the physical level, mental level, the China, not only from physical level, it can re-establish your vitality. So China, for the 7 days, 10 days, we can think of. Or if the patient is of typically China type, only one dose. It is the physician's feelings or perception that what medicine has been working or not on the patient. Just by giving 1 dose, 2 dose on the basis of the reports, and by observing the patient, nowadays video calls are very important. We can understand our medicine is working or not. So China and carbohydrate, it is our steroids like that. It is a very mostly used weapons during this scorching heat. Arsenicum album, another one. Also, you can find the patient of Nux vomica, because during this summer weather, whenever you are taking heavy food at dinner, or you have to attend, you have your own relatives, any celebration, any type of formalities, and you have to take dinner, heavy dinner, So ultimately, the Naxovica is a drug of choice during summer weather. Desire to vomit, the nausea, ineffectual desire, whatever Naxovica has by taking spicy food. The Naxovica also very effective, not only arsenic for food poisoning, but pulsatilla and Naxovica both having fat aggravation. But Naxovica with the tendency of taking food spicy in the late night, and pulsatilla also having, but night or midnight or it is the lunch or dinner, pulsatilla always you can give if it is related to your rich food, if it is the patient having no thirst, and Naxovica with that ineffectual urging or the nausea. So these are our two weapons from abdominal part, Naxovica and pulsatilla. And don't forget also bryonia. For this type of gastritis and urinitis, whenever patient having pain in the pit of the epigastrium and taking food. So bryonia is also very, very effective in gastritis or urinitis, also related to summer or heat weather. Symptoms, typhoid fever, enteric fever also due to taking not safe water, due to our in Rajasthan or in areas where waters are very, the source of water is very poor. The childs and all others, they took water which is not potable water, not safe water, and typhoid fever or enteric fever usually occurs also at the end of the summers. It is also very common in rainy season, but it's also very common because at rainy season, there is contamination from the accumulated rainwater in the roads with the all coolers, etc. But here, during summer, they have to compel to take some water during their dryness of throat, and they may take the contaminated water and enteric fever may occur. Eucalyptus is one of the good drug for elevation of temperature during enteric fever. We can think of symptoms of exhaustion and toxemia. We know all about Babesia, Arnica montana, Rastax, muriatic acid, all these drugs of, there are very many drugs of enteric fever. And we know these are the enteric fever in the first stage, second stage, they give different symptoms of constipation in the first stage.
How many minutes more?
And you can go through the repertorial approach. There are so many things. I will finish my work with this 1 or 2 slides of only elements in summer. You can see these. These are all from single remedy rubrics, and most of all you can see arsenic. Cadmium salt, usually it is written sun exposure from, but we use, it is very efficacious. Already we have established it in the post-cancerous chemotherapy. Whenever there is vomiting, and even in the summer weather, taking chemotherapy and vomiting is there, we may think of cadmium salt 6 potency, and we have very good result, and we have used it in very many cases for cancer patient after chemotherapy. So these are the medicines. So you can see lot of medicine in the repertory, in the NARTS repertory, in the complete repertory, in the KENS repertory. You can see even the single remedy rubric, faint summer Ipica. So you can see the, if I will suggest all the juniors or all the budding doctors, all the seniors, all well aware about this, to go through these single remedy rubrics, and we can get lot of things, lot of gems in our repertory, So even respiration, summer aggravation, argentum nitricum and sipulinum, the last drug. These are the NARTS repertory. You can see, because NARTS repertory is the basic of Robbins repertory, Murphy's repertory, NARTS repertory, the very wonderful repertory from pathological point of view. You can see bluish summer complaint in arsenic, drinking diarrhea, drink soft in summer carbophage, vomiting dentition in summer complaint bismuth, vomiting diarrhea with summer in sudden jatropha, vomiting drink of desire for water within summer complaint antinterd, even stomach hemorrhage summer every for many years Guecum. We know left one drug, but this is Guecum every year for many years, and during summer stomach hemorrhage. Same bryonia, overeating diarrhea. So these are the heat wave do's and don'ts. Avoid going out in the sun between 12 to 3. Drink plenty of water. Wear light weather, very cotton weather. Avoid strenuous activities. Carry water with you, potable water. Avoid alcohol, tea, coffee, and spirited the drinks. So how can I cool my body? Drink cold water. Give some food tips for reducing body heat. Eat curd, buttermilk, sugarcane juice, coconut water, salads full of cucumbers, tomatoes daily, and the limited intake of eggs, red meat, fish pond, spicy food. Maintain hygiene, restrict on tight clothing should be avoided. Avoid usage of too many cosmetic. Eat food that suits your digestion. And during COVID-19, it is observed that wearing our thermal discomfort during summer, when the face mask came, we can see results showed that while 3 shades reduced radiant temperature, mask dampness led to discomfort with intense sweating 54.55% and tachycardia 42.18% being prominent. So consequent of heat waves around the world today are a warming of what is to come. More global warming is coming on. So we have to think of implanting trees and trees and trees. We have to think of our environment, and not only the physical environment, the mental environment also can cause the global warming. So it is also very important. To offer support in restoring our body's balance, health, and vitality. These are the reference bibliography. And Dr. Raiba and Dr. Ritika were the 2 very good PG students of our institute. And all the slides are PPT, for which I am acknowledged. All those and to all PGTs of CHS. Thank you. Thank you all.
Congratulations, sir. It's really a beautiful session, a wonderful session, and that in a short time you have covered all the problems that usually people face during this summer season, and you covered all the medicine that comes underway for the treatment of this COVID also. This summer complaints also, because of lack of time, we will have to cut short the discussion. Anyway, I invite Dr. Mas from Malaysia to say the vote of thanks to the session. This is what I have to say at this juncture. Dr. Mas, please come.
Okay, thank you, Dr. Dinesh. Thank you so much to Dr. Rajat for the sharing the topic on summer complaint and homeopathy. Looking forward to hearing from you more in the future. So on behalf of IFPH, once again, we thank you. Thank you.
Thank you, Dr. Masina. Thank you, participants who attended the session from the very beginning, and thank you, Dr. Rajini Maniakan, for moderating the session. And with that, we come to the end of the day 1342nd. Dr. Rajat has done a wonderful job in this session. We really enjoyed the session. Thank you all. Good night. Tomorrow we will have a session from Dr. Venugopal and MBBS MD doctor from MS doctor from USL. Thank you all. It is all.